because I didn't have to care for other staff before. Now, because I'm a senior, I have to care for both my colleagues and my patients. That's me developing my leadership skills. Two, you also need to be able to understand that everybody learns at different pace. Everybody learns differently. So if I'm interacting with my colleagues, I understand how they learn, and I'll be able to direct my mentorship or my teaching based on their learning pattern, based on their learning pace. So that's you, what's the word? Understanding individualism in your mentorship as a senior. So if you understand that, you'll be able to like direct your mentorship effectively. So just know that with this, you have more responsibility, and then you, while trying to mentor other people, you're also developing yourself in this role. So, so you're also developing yourself in this role. I think I've touched on that. Can we move on? Does anybody have any question with that? No. Next one is, why is good documentation very important? I think I've touched on this earlier. Good documentation helps doctors, nurses, and the MDT to give the right patient care. It's what you document that helps them to know what is wrong with the patient. Doctors will not come down to the ward or to a patient to check patient's blood pressure, patient's temperature, patient's heart rate. It's you that would do that. And it's what you record that the doctors see and know if the patient is improving, if the patient is declining in their health, or if the patient remains. Is what you document that will help them to know if they need to do something else, if the patient needs to be moved to a different ward, or the patient needs to get a different kind of care. If you record, if you don't record effectively, if you don't record the right thing, and it is if you don't record the right thing and they later find out that you actually recorded something wrong, that's trouble. It's not just you losing your job. If the patient probably died during that uh, activity or what you did, you'll probably be sued. You probably go to jail. And once you go to jail, most of us are immigrants here, if not all. You're getting deported after you've served your jail term. So proper documentation is very important. And aside the fact that you're recording what you've found out about the patient, blood pressure and all of that, if something happens, if a patient falls, you record it. Where were you when the patient fell? What happened? Is the patient fine? Aside the doctors recording what they have found out, because doctors, everybody will come when the patient falls. You say your side of the story before they say it for you. It's very important. Write it down, document it before anybody says it for you. If you're trying to give a patient a particular kind of care and the patient declined, write it down that the patient declined. Because if tomorrow they come and say you didn't even care for this patient, and you're saying, oh, I tried, but the patient declined, it was not recorded. So you could as well be lying. So good documentation helps doctors and nurses give the right care. Good documentation is good communication. So if you document well, you communicate the right thing to our colleagues. Patient safety. The fact that you recorded what has happened, what is happening, helps the patient safety because it helps to give the right care. It also gives you a legal cover because if you have recorded what has happened, then you have a cover. You can always go back to it. If you've recorded that at this point in time, this patient was here, it gives you legal cover that when something happens, they know that you recorded it. And lastly, it's also according to, I'm sure it's according to every trust policy to give good documentation. So I think we've mentioned how many for that. One, two, three, four, five, and six. 6 points is that. And then when somebody asks you why is good documentation very important, after stating all of this, it's important to give examples. Give a scenario. Oh, there was a time I was working on a ward and I was trying to, I'm trying to think of an example. I was trying to help this patient use their medication, but they were declining. So I recorded that the patient declined after several trials. Eventually, when the patient's family members came on, they reported that the patient had not been looked after because the patient had not been taking his medication. After further investigation, it was discovered that I had previously recorded that the patient declined. So they were able to close the investigations that the patient declined. If I had not recorded, they would have probably come to me to say I had not encouraged the patient to use this drug, which would have meant that I didn't do my job effectively. So that's just, it has given you a scenario, it has given you what you did, it has given you the action, and it has given you the results. Star, easy as that. So the next question, if anybody has any question, please just indicate so I can address it. Next question, can you tell us about a time where you really made a difference to the patient in your care? This is a scenario and they want you to give a scenario-based answer. What's the situation? The example I gave, the situation is that I was in charge of looking after a patient and it was for a week. This patient has not been showering or has been declining to shower. Scenario. What's the task? I'm in charge of looking after this patient and ensuring that the patient does his day-to-day activities. I'm in charge of empowering this patient to do things on his own while still helping him. Now, your action. I persuaded this patient to shower. The reason why sometimes your actions might feel like it's the bare minimum is because most times some people don't want to work. So when they go to a patient and say, would you like to have a shower? And the patient says no, they just turn back and move. Patient declined. They write it down. Whereas you can go further to encouraging the patient, telling the patient that, oh, you know, we're trying to look after you, we're giving you medications, and if you don't shower, these things will not really be effective. So you need to do that. Even if you don't want to do it every day, because remember, this patient had not had his bath for a week. So if you tell the patient you don't have to do it every day, you can do it today and every other day. That's suggesting a solution to the patient. So, like the example I was giving, action, I encourage the patient to go to the shower and also promise to help the patient. The patient was shy, but I was able to encourage them to go. After doing that, the patient felt really relieved and relaxed, and patient slept 15 minutes after. The patient also thanked me for helping them to feel comfortable with the shower, and then that was it. Now you could have turned back after the patient said no to showering, but you went further to do what every other person had not done in a month or a week, whichever the question is. So that is you making a difference to patient's care. What everybody has not done, but you decided to surpass that expectation of you. Everybody expects you to go there, ask the patient, If it doesn't happen, you record it. That's the expectation. But you surpassing the expectation is going further, trying to, and it's not you forcing the patient, obviously. It's just you trying to encourage the patient to do better. That's that. Let's see, I have a lot of questions here. If you are asked to supervise and support new starters, what would make you a great leader? So this is just stating good leadership qualities. Um, Simply put, stating good leadership qualities. But so fairness, kindness, good communication skills, understanding each person's learning style, like I said earlier, not being judgmental, being calm under pressure, giving and taking constructive feedback. This is very important. We know a lot of people say, I have an open door policy, you can talk to me anytime, but not everybody takes constructive feedback. The fact that I'm your senior does not mean I wouldn't make mistakes, or there are some things that would be doing incorrectly. So being able to take these constructive feedbacks, because also they have to be constructive. I cannot just come to you and say, do you know you're very stupid? You do things in a very regular way and you disrupt everything. I can't work with you. That's not constructive. But when they put it in a constructive way, you should be able to take it, and you should also be able to give constructive feedback, constructive criticism. You don't shout at somebody in the presence of every other person, or even shout at them at all. Sit them down, tell them what they've been doing right and what they can improve on. That's constructive. You don't just go to everything they've been doing bad. Every time you talk to them, it's something they're doing bad. So constructive feedback is also very important. And creating a safe space to share vulnerabilities. A lot of people have vulnerabilities, especially in this country. A lot of people are struggling with the job because they know that they need a job. Some of them might not be able to open up on what they are struggling with. But being able to create that safe space to share your vulnerability is also a very good leadership quality. So this question only wants you to state good leadership qualities that you are bringing to the job role. You can also go further. Like I said on the group, examples don't never hurt. You can also go further to sharing an example of how you've showed a good leadership quality. Even if you've never held a leadership role before, you can show those qualities, because aside the fact that they are qualities, they are also good general qualities that everybody should have. Everybody should be fair. Everybody should be kind. So that's that for that question. So now we go to the scenario-based questions. A patient with dementia struggles to communicate and becomes distressed. What action would you take to alleviate their distress? First, you need to understand what dementia is to answer your question. Because if you don't understand that, that's the end of the question. You would never answer that question correctly. So, dementia, simply put, the patient forgets things. The patient might be here today. You tell the patient you're in hospital. The next minute, the patient has forgotten. They don't know where they are anymore. They can't remember things. They can't remember people. They can't remember experiences. Dementia, simply put. So now this patient is struggling with communication because at some point you tell the patient, you need to eat your food. The next minute, the patient is like, why do I have a food on my table? And there's just miscommunication. Now this patient is distressed, is agitated. What would you do differently? Note that this answer can also be used for different other questions. So it's just important to understand how they're answered, and we'll be able to tailor them to the other questions that we might have. First of all, stay calm, because the patient cannot be distressed and you're also distressed and agitated. Be calm. That's the first thing I will answer. I'll be calm and then reassure the patient. Oh, it's all right. It's okay. Don't make them feel like because they have a condition, they are a burden to you or they are stressing you out. So just let them know that it's fine, stay calm. Then don't rush them. Don't rush them. You can sit down there for the next 20, 30 minutes, just trying to reassure them, just trying to stay calm. And then acknowledge their feelings. One thing that over time I've come to realize that people do wrong is saying, I understand how you feel. I understand what you're going through. You don't understand it. You don't understand what they're going through. You can never understand it until you have dementia yourself. So don't say, I understand how you feel, I understand what you're going through. Instead, say, I can see that you're distressed by this situation. I can see that this situation is making you agitated, but it's fine. You can see it, you don't understand it. So I just want us to take note of that. You don't understand their situation. Um, and use simple communications. That's not the time to start using medical jargons. Use simple communications. Write if you need to write. Use gestures if you need to use gestures. Even if you need to draw, you draw. Make it as simple as possible for these patients. That is where good communication also comes into play. So make it as easy as possible when it comes to communicating with patients with dementia or your patients generally. And then while they're being agitated, remember this patient is has dementia. You can try to distract them from that particular situation. Bring in something else. Bring in like a teddy bear if they have that teddy bear. Talk about their children if need be. Talk about the music that you know that they like if need be. And while doing that, also take note of other needs. Oh, would you like a cup of tea? Would you like this? Would you like that? That is distracting them from that situation, which could also alleviate that distress that they are feeling. So that's simply put with that. If anybody has any question, please let me know. I feel like I'm just talking to myself. Um, yeah, and then let's not forget we need to document. You need to document that distress because if you don't document it, the patient was never distressed. The patient never had any issue that you try to resolve. So document and escalate because there is a limit to what you can actually do as an healthcare professional or as an healthcare assistant rather. So once you've done everything in your power, you escalate to the next person in line. If you are okay, just hold on. If you are an healthcare assistant, you escalate to the senior healthcare assistant or the nurse if you have one around you and that. Adenike, please go ahead.
Yeah. Thank you so much. Please, somebody in the group this morning said she used the star um whatever
The
to
star
answer
method,
a
yeah.
question, star method, which you just finished talking about now.
Yeah.
I was taking the note. I noticed that I don't know, maybe I missed it. You stopped at the A, which is
Yeah,
action that
action.
you've
Yeah.
taken, but I noticed that I don't have the response. I don't, maybe I
All the
missed that
result.
in your explanation.
Thank you very much. Thank you.
Thank you.
So so I'm just trying to what I've just explained now, I've not given a scenario. I've just stated what I will do differently, the things I will do when a patient is in distress. The situation or the place where you now use star is when you're giving a scenario, an example of where this would work. So I haven't stated all this. You can now go further, like I said, give examples. You can now go further to say, oh, there was a time I had this patient that needed this. I used all of these skills to alleviate that distress, and eventually the patient was calm, and the patient was even able to communicate with me further, and we had a very good shift. That's you using the star. The star is just basically giving an example, giving a scenario based on a question. I hope you understand. I didn't get. So everything I've said earlier,
Yes, yes,
yeah,
thank you.
yeah, everything I've said earlier is what I will do, the skill I will put in place, the things I need to do. Now, with all of that, with the knowledge of that, I can now use that to give an example and how that thing worked for me and was effective. So, yeah. Um, the patient is not eating at mealtime throughout your shift, and you're not confident they will eat at the next mealtime after your shift. What would you do? Like I stated earlier, some people go there, can you have your food? No, and they move back. They just go. They don't care if you eat or not. As long as you've said no, it gives them an easier job to do. They don't have to like do anything else. So they just leave. But what you would do, basically, it's an interview. What I would do differently is to encourage the patient to eat their food. While you're encouraging them, you don't want to keep asking, please eat your food. It's good for you. If the patient is becoming agitated, saying, no, I don't want to eat, just leave me alone, don't continue. Then you offer alternative. Oh, you don't want rice. Do you want bread? Do you want a toast? Oh, you don't want this. Do you want porridge? You don't want porridge, do you want this? Offer alternatives. Don't force something onto the patient because when you're persuading them to do the same thing that they are saying they don't want to do, it's becoming a force. Sorry about that. So offer alternatives to what they want. Then explore reasons why they don't want to eat. Is it that they are fasting? Is it that they have a problem with their throat or with their mouth? Is it that they have like they are constipated? Different things. Try to find out why they are not eating and then document your concerns. Well, this patient has not been eating. I discovered that this. Document it, escalate it, escalate it, and hand over effectively. So while even doing that, monitor for other signs. Like I said, try to find out why they are not eating. Is this patient running temperature? Does the patient look dehydrated? Is the patient looking tired? So try to look for other signs to ensure that you're able to hand over effectively. And then, like I said, give examples. Example that I would give that I think works every time is during Ramadan, we discover that a patient has not been eating throughout the day, only eats at night. We tried to find out why. We kept encouraging this patient to eat, but she never answered. And because she didn't want to share that she was fasting, she never answered. But I was able to discuss with this patient, persuade this patient, and I was really patient with her. And then she eventually opened up to me that she was fasting. This helped us to ensure that every morning around 4 or 5, we ensured that the patient had something to eat to start their fast. Because before that time, nobody cared about giving food to the patient at that time. So it helped us to give the patient food at 4 or 5, and then we understood that the patient would not eat anything throughout the day until 7. So the patient was really happy because we cared for her individually, personally. While other people were not eating, she was eating in the morning because she was fasting. She eventually thanked us for this help and was very, very appreciative. Even when her family members came, she was so happy to share that experience with them, and we got a good recommendation from the family. Scenario, task, action, and then result. Star. Simply put. Uh, so next question. How would you ensure that you were working within your competence at all times? So while we're trying to impress, sometimes we forget that some things are not our job role. Because we're trying to do a lot of things, we're trying to show that we're good. We forget, or we sometimes forget that. we're not supposed to do some things at all. The fact that I have skill with cannulation, I can do bladder scan, I can do ECGs. You shouldn't forget that, oh, if I band two, you shouldn't do that. So that enthusiasm of, oh, I want to help, let me just do it. If something happens, if you were supposed to do it and something happens, that gives you a cushion. But if you were never supposed to do it and you did it, you're in trouble. It's a big trouble. It's something that a registered nurse will lose his or her pin on. And because we don't have a pin, it's further trouble. So, how would I ensure that I am within my competence? Know your role, know your job responsibility, read your JD. This is what I'm supposed to do. This is what I'm supposed to do. If anybody is giving you additional responsibility that looks like you shouldn't even be doing, let them put it in writing. Some additional responsibilities are probably, can you go down to the pharmacy to get some medication? They don't need to write that down. You're just collecting medication. But we are telling you to annihilate a patient because they know that you're competent. Let them send you a mail that they are giving you a go ahead to do it. And the person that is sending you a mail shouldn't be like a registered nurse. It should be your manager. Do you understand? So know your job role. And if anybody is giving you additional job roles, you get it in writing. Anything that you're asking you to do, you get it in writing. Secondly, recognize your limits. We know our limits. You know that I can't do this thing. For example, even something within your role. For example, um, they say a patient is assistance of one to mobilize. And then because every other person has been doing it, you try to do it, but you feel that this patient is too heavy for me. I can't help this patient. Don't try to do it. Ask for help. Tell them, I can't do this thing alone. Let people believe that, oh, you're too lazy, you're protecting yourself. So know your limits, know what you can do and what you cannot do. Don't push yourself further than that. Number three, seek guidance when needed. Some of us are too proud. Me, I call it pride. Some of us are too proud to ask for help. They will tell you, can you do this? Yes. Can you do this? Yes. Can you It's pride. There's no there's no shame in saying, oh, I cannot do this, but I'd like to learn. I can't do this, but I can watch you do it so I can know how to do it next time. But pride sometimes will not let some people ask for help. So ask for guidance when you need to. It will save you a lot of hassle and stress. Next one is undertake training and keep your skill up to date. Take trainings. Take trainings, both online, both physical. Take trainings. You can even ask your managers that, oh, there's this training that I saw and I would like to do it. Is it available for us to do? Keep taking trainings to update yourself. With those trainings, you'll be able to like work further, and then you know that some things are within your competence because you've been trained for it. If you've never done a resuscitation training and a patient is down, you wouldn't go there and resuscitate the patient because you've never had that training. But if you know that you've done it, you know it's within your confidence, your competence rather. Even if you've never done it, there's this confidence that you have that I've had this training, I can do it, and then you go ahead with it. Um, Next is report your concerns. Always report your concerns. If you see something unusual, report it. Report it. Report it. Um, and the last question here is, how will you support the senior nursing team to reduce falls, pressure ulcer, and infection? Falls, pressure ulcer, and infection. So I'll talk on the falls part of the question first. Please note that all of these questions, you can always give examples at the end after explaining it. You can always give examples and give an experience. So how would I support the senior nursing team to help reduce falls? So Um, First of all, to help reduce something, you know what cause you need to know what causes it. You need to know what makes that thing happen. So for falls, what makes fall happen is probably there's a clutter around the patient's bed space. The patient is probably just coming back from the theater. The patient is not steady on their feet, things like that. So if I know all of these things, I know how to prevent it. First off, to prevent falls, I need to ensure that the patient's bed space is decluttered at all time, and I keep the patient bed space safe. You ensure that the patient is wearing the right footwear, because if the floor is slippery or is tiles, the patient can easily slip and fall. But with the right footwear, it means that the patient would not fall. Identify patients with falls risk. So if patient is just coming back from the theater, you know that they won't be steady yet. They'll still be dizzy and all of that because of all those medications that they were given. So ensure that you identify them. Also, you follow care plan and risk assessment. Follow care plan and risk assessment. So if your care plan says patient is assistance of two, even though the patient looks young and they can stand on their own, don't go there on your own. Follow it. Go in twos. Risk assessment says because this patient is just coming back from the theater, they cannot stand yet. Don't make them stand. Don't encourage them to stand. It's not your job to encourage them to stand when it has been clearly stated that they cannot stand. Also, ensure proper lighting. Some people do night shift, and because they want to rest their eyes, they turn off all the lights, not even a side lamp or something to help the patient walk. And when the patient is going to the toilet or something, you just tell them, oh, you can go, especially when the patients are independent. So, proper lighting is also important. Also, ensure that everything that the patient needs, like their drink, their call buzzer, if they have call buzzer, and everything is within reach. You don't take it far away from them and they try to reach it and fall. Make sure that it is within reach. Also, promote safe mobility. I've stated earlier, if you say a patient can use a Zimmer frame or a walking stick, you don't encourage them to walk without it. If they say a patient can only use a Sarah steady to move or to mobilize, you don't give them a walking stick to move. If they say a patient is only assistance with hoist, cannot move at all, you don't bring the Sarah steady and say, just try, you can do it, just try. No, it's not your job. You're not a physiotherapist. It is not your job. Whatever style of mobility has been prescribed for the patient, follow it to the latter. That is how you prevent falls. Um, yeah, that's for falls. For pressure ulcer happens when a patient is in the same position for a long time. And the reason why we don't have pressure ulcer is because we're able to mobilize. If I sit down here, I can stand up, I can turn, I can readjust myself, so I don't have pressure ulcer. So having that information helps you to reduce pressure ulcer. Now, what would I do to do that to reduce that pressure ulcer? One, I check patient's skin. Check their skin. What is going on with this person's skin? Identify patients that have high risk of pressure ulcer. And which patients have high risk of pressure ulcers? Those that don't mobilize. So you know that because this person doesn't mobilize well, they're at risk of pressure ulcer. Take pictures. Different trusts have different ways of doing this. Sometimes they have like medical photographers. Some trusts have like an app on their iPads where you can take pictures. Take pictures of what you've noticed. If the patient's skin is deteriorating, take pictures of it. Also, support their skincare. Some of us think because patients is in the hospital, they don't need any skincare support. If they need to use moisturizers on their skin, if their skin is dry, use moisturizers. If they need to use barrier cream, use barrier creams to ensure that 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 pressure ulcer is not there. Also, patients that are incontinent, patients that weed themselves, that poo themselves, make sure that you check them regularly. You check them regularly. Checking them regularly also helps them to prevent moisture damage. Helps them to prevent moisture damage. So check incontinent patients regularly. Nutrition is also a big deal. So you discover that patients that are skinny have more um, have more tendency to have pressure ulcers. So check their nutrition, ensure that they also eat well, ensure that they eat regularly, record what they have eaten, record what they have eaten, record when they are not eating, record how much they have eaten too. Also, their pressure relieving mattresses. If you discover that this mattress is encouraging pressure ulcer, you suggest pressure relieving mattresses to the nurses and then follow up with them to ensure that this is done. You can also suggest it to them. If they tell you, oh, this patient does not need it because of this, you're not the professional. If they have told you the patient does not need it, you move on, but suggest it to them. Also, this is the most important one. Educate your patient. Let the patient know that, oh, because you hardly mobilize, you're at risk of pressure ulcer. So you need to like change your positions regularly. So whenever you come, let's say you go there in the middle of the night to say, oh, I just want to change your position. The patient understands why you're doing it. They don't just feel you're disturbing their sleep. So educate patients. The patients also know and help them. Sometimes they just remember that, oh, I need to change my position, and they do it. Remember, you're not doing all of these things because you just want to record that you have done it. You also have the interest of that patient at heart. So the more they do it, the more it helps them to reduce pressure ulcers, and the more good you are at your job. Lastly, document and raise consent. Document and raise consent. Whatever you do, document, raise consent. Remember, you are the first contact. You are not at the highest ladder. Raise consent, escalate it, and document. That's for pressure ulcer. And lastly, for infection, how to reduce infection. One, you maintain good infection control. Maintain good infection control. That's you wash your hands regularly. You use the right PPEs. If you need to use glove when attending to these patients, you use gloves. If you need to use your mask and aprons, you use that. Don't just say, oh, I'm just going in and coming out. Use the right PPEs. Wash your hands regularly in the right way. Don't just and go. Wash your hands regularly the right way. Two, dispose your PPEs correctly. There are different bins for different things. Don't just dispose PPEs anywhere you find. Dispose them correctly. That also prevents infection. Three, isolate infectious patients. Isolate infectious patients. When you discover that the patient is infected and the patient is still in the same bay or room with other patients, escalate it. Let them know this patient shouldn't be here. The patient should be in a different place. The patient should be isolated. All of these things are things that you will do to reduce all of these things. So whenever you're communicating it, communicate it as though you're doing them or as though there are things that you will do. So I would say I would ensure that I maintain good infection control, like washing my hands regularly and using the right PPEs. I would ensure that infected patients are isolated. Also, another important one is to educate your patients. Let them know that, oh, because you're infected with this, we need to isolate you. Because you're infected, you cannot come out of this bay until you've been cleared. Because you're infected, you need to wash your hands regularly. Or because we want to protect you from infections, you need to wash your hands regularly. You cannot go into that bay because infected patients are there. Educate them. And then use single use equipment as single use equipment. When they say something is single use, you don't use it multiple times. Use it and throw it away. It's not your money. You're not the one buying it. Don't say, oh, I don't want to waste it. I only used it for like 2 seconds. If it's single use, use it only once. And there's some equipment that are single patient equipment, like maybe blood pressure cuffs or something like that. If it's a single patient equipment, don't use it for multiple patients. Use it for one person and one person only. Also, clean your equipment at touch points. So if you're using some equipment that touch patients at some point, clean those equipment, clean them. Um, Also ensure patients' hands are clean at mealtime. When they're about to eat, clean their hands very well. And I think we've touched on all of the questions here. So if you have any question, whether regarding this or anything, if I have an idea about them, I'll answer. Thank you. Thank you. Thank you, Chris. So any question at all, anything you want to know within the NHS, outside the NHS, within healthcare, outside healthcare, about interviews and all of that, just let me know. And if you're still writing down things or still putting your questions together, you can let me know when you're ready. I'll chip in something after the question. But if we don't have questions, I was speaking with somebody earlier and he was asking about, for people that are interested in IT, was asking about how would you know the right certifications to do? How would you know the right certifications to do? For me, I check all of the job roles that I'm interested in and I went into their requirements. Most of these job roles have requirements. So you must have CompTIA A plus, you must have ITIL, you must have this, you must have that. So I got all of those things down to tailor my education or to tailor um, to put me on the right path for the right certifications to do. So if you just go online, somebody's saying, "Oh, I'm doing data analysis," you get all their certification. Somebody is saying, "I'm doing business analysis," "I'm doing cybersecurity." That will just confuse you. You cannot know everything. Even within a particular job role, you cannot know anything, everything. So pick those certifications that might not be required, but they just put them there as something that will put you on a better pedestal. Put all of those things together and then pick them one after the other. Because while you're also learning them, you're building your knowledge. For example, I'm studying for CompTIA A plus. I've not gotten the certification, but it's on my CV because the fact that you're studying for it means that you know some things. You have knowledge about some of these things, even though you have not written the exam yet. So basically, check all of those job that you're interested in, check their descriptions, check their requirements, and pick the certifications that are required, and then that would help you. So I think we're through for now. Praise, let me know if I need to do anything else.
Um, e- Thank you so much. Like I said, I'm on my way to work. I want to thank you for this opportunity. I mean,
You're
it was just
welcome.
like an impromptu stuff, and you were here to help the community members to guide them. Guys, let's just say thank you to E in the comment
You're
section
welcome.
if you can.
And then, okay, Gigi is raising up her hands. Let's see if she has anything to say.
Okay, JJ, go on.
Hi, sorry, that was an accident. Sorry, I'm not meant to
Oh,
speak.
it's all right. It's all right.
Good. Did she say it's a mistake?
Yeah, yeah.
All right. So they're currently saying thank you to you in the comment section.
You're
E.
welcome, man.
For those who does
You're
not
welcome.
know, I and E went to the same uni in Nigeria, and it's been my friend for the longest of time. So the community is there for you to ask your question, anything. And like I will always say, if you ask a question and you're not getting a response immediately, just know that some persons are on their way to work, just like I'm on my way to work, and some persons are busy. So thank you so much. In the absence of that, we can call it an afternoon, or you can round up the call and just end.
How do you round up the call? I don't know. But anyways, guys, thank you for this opportunity. It's while even saying some of these things, I've learned other things myself. So thank you very much for this opportunity. Thank you for everybody that stays. Thank you for the questions. And
Yeah, I'm sorry, E. I wanted to say
yeah,
something else. Just to let you guys know what we're planning for the community. So he is currently in the healthcare and he used to be in tech and somehow he's trying to find his way back to tech in the UK. Same as me. I used to work in tech sales and project management, so I'm finding my way back. And same as my co-founders too, that is Josh and Chino. So we're planning a career program for next week because I know definitely that we have a lot of people in the community who doesn't just want to do healthcare. They're just doing healthcare for the meantime because that's what they can do. So the career program will be coming up next week. Further information would be passed in the group. So I just wanted you guys to, keep your eyes on it. Even if you're not ready, once the session comes up, try and attend this session because it's going to really help you in transitioning. Do you understand? So yeah, that's it. Thank you. Over to you.
all right, all right. Thank you. So would look out for that too. Like she said, I used to work as a fraud analyst, and I used to be in IT basically. But then we're here now, and we're trying to like transition back into that field. So let's just keep pushing. And one thing that my mentor has told me is that you would get more no's than yeses. So you might apply for 100 jobs and you get 99 no's just to get that one yes. So let's keep pushing. Let's just keep applying for everything and anything.
Hey,
Yeah.
one more thing, guys. Guys, please don't forget that this is Kill and Grow. If you have friends, families who are looking for this kind of opportunity, kindly let them know what we do in Skill and Grow. Share the link to them to join. And like I said, we don't know it all. We're here to help each other. We could have even somebody on the call, like there's JJ on the call. There used to be AIM on the call. There's a lot of people on the call who have a lot of experience to share. If you're happy to jump on the call, we'll just open the session for you and you just guide people. Somehow, these things also helps you improve in your presentation skills and build your confident level. You'll be thinking, oh, I don't want to do this, I don't know. But once you start teaching people, once you start, presenting, it boosts your own confidence. You'll be thinking you're helping other people, but you're also helping yourself. So let your friends and family know about Skill and Grow. Share the link to them to join the community. And if you have any initiative that can help the community, please reach out to any of the admin so that we can work collaboratively and just get it done. So that's it, guys.
All right. So I think we're good for now. I need to get back to working now. So take care of yourself. I wish you guys all the best. And then don't be strangers. You can always reach out anytime. Bye.
Thank you.
You're welcome. You're welcome.
Thank you very much.
Bye. You can reach out on WhatsApp on the group. You can always reach out on the group
All right.
to
Oh,
catch.
thank you. All right, thank you so much. I actually want to reach out because I know I can get every other thing in the group for this. But because you said you
Okay.
are transitioning from tech to healthcare, and I have a son that is into tech, that's why I say, how do I reach out? So it's out of
Oh,
this, and we've been looking at, oh, should he continue in that tech, and also I'm thinking he should have something in healthcare so that to balance it, you know how it works
yeah.
so that
You can
to
also
be on the safer side. Yeah.
work in tech while in healthcare if you understand.
Yeah.
Yeah. So we
Yeah.
have
That's
healthcare
good.
technician and all of that. Yeah, but you can always reach out. We would talk.
All right. All right. Thank you so much. Thank you for the to the conveyor of this meeting.
Thank you.
Really appreciate it. Thank
God
you.
bless you.
Bye. God bless.
Bye.
Thank you.